Hello, my name's Roger Watson and welcome to the Jan podcast of 9th of September 2018. Scared of needles? This is Roger Watson, the Editor-in-Chief of the Journal of Advanced Nursing. Are you frightened of needles, by which I mean injections given for medical purposes? I guess we all are, as no matter how often you have one at the dentist or at a surgery, it hurts. Yes, it does, and we all anticipate that initial stab as the outer layer of the skin where the pain receptors are located is punctured. But most of us put on a brave face and pretend not to be frightened. Some brave souls may genuinely not be frightened, but I am, and I don't mind admitting it. However, while most people learn to accept the momentary discomfort, some people never do and genuinely have what is described as fear of needles. This fear of needles was the subject of a study from the USA by Mclenon et al., published in 2018 in Jan, titled The Fear of Needles, a Systematic Review and Meta-Analysis. The review found 35 relevant articles and established that the fear of needles ranged from 20 to 50% in young people and up to 30% in adults. In some people, this has serious personal and workplace protection significance, as avoidance of influenza vaccination because of needle fear occurred in 16% of adult patients, 27% of hospital employees, 18% of workers at long-term care facilities, and 8% of healthcare workers at hospitals. According to the authors, needle fear was common when undergoing venipuncture, blood donation, and in those with chronic conditions requiring injection. The authors concluded, fear of needles occurs frequently in populations throughout the world, with higher prevalence at younger ages and in women. Fear of needles is common in patients requiring preventive care and those undergoing treatment. Greater attention should be given to alleviate this fear, with an ultimate goal of improving health. We recommend implementation studies of non-needle approaches to standard needle injection, with direct application to public health and clinical settings. We also recommend randomized trials to assess specific cognitive and behavioral strategies to alleviate fear.
This podcast was produced in association with youthpublicationslimited.com.